I'm Mackenzie O'Keefe in the CBS in Denver studio. Dementia and Alzheimer's take a toll on not only the patient, but also on their family and the caregivers. The disease brings out some difficult behaviors that can be challenging for just everyone. So here now is Dr. Alfredo Rivera. He's a psychiatrist and the medical director of senior adult services at the HealthONE Behavior Health and Wellness Center. So Dr. Rivera, what are some of the most common dementia-related behaviors?
Well, we usually attribute issues with memory and judgment. I would like to just take a second to remove the memory part because certain types of dementias doesn't require a memory impairment, and replace that with the emotional response to impairments in dementia. The emotional response is a defense mechanism for your losing your capacity or your faculties. And more common responses would be things like anxiety, depression, and anger. The problems with judgments are often missed. Things like driving, for example, I would recommend next time you visit somebody you think has an issue with dementia, would go in the garage and check their bumpers, because they're not going to be able to tell you that they had an accident unless you find it. Decisions is the major problem with dementia, and that's why we have to really focus on this illness. Decisions with money, for example. This population is very susceptible to scams, and this is very popular nowadays, unfortunately.
Interesting. Those are all great things to know about and keep aware. Are there certain things that can trigger some of those emotional behaviors that family or friends should be aware of?
Yes, I think the most important thing is routine. Any changes in routine, if we ever go through it, we have this capability to adapt to it. The problem is in a patient that has dementia, they are functionally maximally at this point in time and unable to accommodate any changes in routine. So you'll frequently see issues like during the holidays when the family comes together and they see mom or dad for the first time in months. It's very overwhelming for a patient with dementia to have that kind of scrutiny, have all those people, especially if you don't remember all their names of the grandchildren and whatnot.
And like many others, my family's had dementia and my grandma for years. So I'm curious, what's like the best way for families and caregivers to deal with all of this and handle it? What advice would you give them?
I think the best advice I can give is put yourself in their shoes. A great exercise to try tonight is to find your darkest sunglasses and put one earbud in. Walk around the house, and that's kind of what you kind of have to deal with when you're having cognitive impairment. You're trying to figure out things, and sometimes you can't figure things out. Answers are more or less important than questions depending on who are asking them. So if you're asking the questions, you want to include answers or outs, so then patients don't get frustrated because they can't figure things out. Other things that would be like childproofing your home, I think, is very important on patients who have memory impairment. Sometimes those things that we use when we have toddlers in the home are equally effective in somebody with memory impairment. I just want to let you know, memory impairment actually requires accommodations. But when I mentioned those symptoms of judgment before, judgment requires interventions. And so I'm glad that we're having this discussion now to look what we can do for these patients.
Absolutely. It's just so important. And, I know you touched on a lot of great tips and advice, but what about for family and patients who have just recently gotten a dementia or Alzheimer's diagnosis? Is there anything right off the bat they need to do?
Well, they say there's no I in team. So you need to develop your team. You cannot deal with this alone. There's 6 million Americans with Alzheimer's dementia, 14 million caregivers to deal with those 6. So there's at least a 2-to-1. You need more than 2. You need to have your immediate family, your extended family. You need to have your doctors and specialists, not if you're relying on your primary doctor, he may have to focus on some of the other aspects of medical care and will distract from this particular issue. Neighbors, organizations like the Alzheimer's associations, senior centers, daycare, other aspects that you can add in would be extremely helpful. And, you need to ask for help. I always tell people, you need to refrain solely on Google giving you advice. You need to actually have other people with skin in the game.
Right, so important. Well, Dr. Rivera, thanks so much for joining us. I'm sure this will be really important information for so many people and families. We appreciate it.
Well, thank you very much.
Of course, and we'll put more resources for families and caregivers on our website, cbsdenver.com.